pleasure in introducing Dr. Cathryn.Cruz. Dr. Cathy.Cruz has done her professional training as a medical doctor in the year 1995 from the University of Western Australia. She got her certification of Maharshi Ayurveda in a doctor's training course at the Maharshi Vedic College in Melbourne in 1998. She is in charge of the Desana Integrative Medicine Clinic at Wembley, Western Australia, and she is an integrative medicine practitioner, and she is one of the only 2 doctors in Western Australia to incorporate Ayurveda into general practice, and she has been instrumental in including Ayurvedic medicine as one of the main treatment modalities offered at the Desana Integrative Medical Center, and she has had a long interaction with various Vaidyas in India. She is a frequent visitor to India to upgrade her skills, and she is Vice President of the Maharshi Vedic Health Practitioners Association of Australia, a position which she has held for the last 4 years. I welcome Dr. Cathryn.Cruz and would request her to make her presentation. Thank you.
And I wish to thank the organisers of this Congress for inviting me here today and for allowing me to speak. I am a medical practitioner in Australia, and I practice integrative medicine. I incorporate the best of modern medicine with the best of natural approaches to health, which includes Ayurvedic medicine. I attended a doctor's training course in Melbourne in 1988, and although this did not make me an expert in Ayurvedic medicine, it allowed me to incorporate Ayurvedic diet and lifestyle principles in my everyday practice in general practice. And after many years of doing this, as well as having the opportunity to sit in with many eminent visiting Vaidyas to Australia, and also to have the opportunity to have work experience with Dr. Raju at the Maharishi Ayurveda in Delhi, and I am honoured to be sharing the dais today with Dr. Raju, I have come to really appreciate the value that Ayurveda can play in general practice in Australia. Ayurvedic medicine incorporated into general practice has proved very popular with my patients in Australia, and it has also proven to be of great benefit. It has been particularly useful for the conditions related to poor digestion, insomnia and fatigue, and I have to say that these conditions are rather endemic in the Western society. In Australia, there is a growing interest in natural medicine. A recent market research indicated that 74% of Australians regularly use complementary medicines, and there is also a growing interest in Ayurveda since about the 1980s, and this was due to 2 factors. First of all, Maharishi Mahesh Yogi revived Ayurveda in its complete form, which was of the highest quality and consciousness-based. As well as that, Dr. Deepak Chopra wrote many excellent books on Ayurveda for the layman, and these books were very well received in Australia, and Australia came to know Ayurveda also through his tours. And since then, Ayurveda has continued to grow, and there is greater and greater interest in this wonderful health modality. Also in Australia, there is a growing concern with the hazards of modern medicine, which includes accidents and side effects. And patients in Australia are now looking for more natural approaches. And this is where Ayurveda has much to offer in Australia, in that it is time-tested, it is of lower cost, few side effects, and it is truly holistic. As Dr. Bodhika mentioned, when we compare Ayurvedic medicine and traditional Chinese medicine in Australia, we can see that traditional Chinese medicine has achieved a much greater prominence. And it's interesting because both are alternative medical models who use a completely different language to the Western medical model predominant in Australia, and they have a different way of expressing wellness and illness, and yet traditional Chinese medicine has achieved much greater prominence than Ayurveda, and this is especially so in the area of acupuncture. In Australia, acupuncture enjoys the same benefits and favours as any other recognised medical modality. And so as a practitioner, a general practitioner who incorporates Ayurvedic medicine, I face many obstacles to my free practice, which include financial, cultural, medical indemnity, education and training, trade, which is access to herbal products, information obstacles, and network and organisational obstacles. First of all, with financial obstacles. In Australia, we have a government-funded universal healthcare system, which is called Medicare Australia. When a patient in Australia receives any medical services, the government will pay a portion of the fee that the patient paid for those medical services, and the amount that the patient receives is called the Medicare rebate. To date, Ayurvedic medicine is not awarded any Medicare rebate. And so, my patients and all patients in Australia, when they see a medical practitioner, they have come to expect a Medicare rebate. So, my Ayurvedic practice has to be limited to Ayurvedic diet and lifestyle advice given in the context of a Western medical consultation. If I were to provide an Ayurvedic consultation as a standalone consultation, then my patients would not receive any benefit at all from our government, and this makes them feel suspicious about this sort of model. They think if it doesn't award any financial assistance, perhaps it may not be safe or acceptable. Recently, I was investigated by Medicare Australia because Medicare Australia tends to investigate doctors who practice anything different. And of course, Ayurvedic medicine is quite different. And after their investigation of myself, they wrote a report to me. And in this report, they stated that the use of Ayurvedic medicine is not recognised by mainstream medicine in Australia and may not be regarded as being appropriate by a committee of peers who are the general body of vocationally registered general practitioners in Australia. They went on to say that the practice of Ayurvedic medicine by medical doctors remains controversial. So Medicare Australia made their position quite clear to me, and in a way it was a subtle threat. They, in a way, were telling me that they really don't want me, as a medical doctor in Australia, to practice anything different, which includes Ayurvedic medicine. They feel that the area of Ayurvedic medicine should be left to health practitioners, but as a medical doctor, I should not be dabbling in such alternative medicines. Then there are cultural obstacles. The main one is communication with other health professionals. This is very difficult. Not only do I have to explain a completely different medical model to another health practitioner and explain what I am doing and how it works, but I also have to explain why I have chosen not to use the conventional Western medical approach. If something goes wrong, then I, of all people, as a Western-trained doctor, should have used the Western traditional approach. And so I, of all people, are more answerable if I turn my back on the Western model and adapt an Ayurvedic model. Another obstacle is the extra time needed to explain this model. Most patients, when they come to see a doctor in Australia, are expecting an allopathic remedy. If I see this patient and feel that an Ayurvedic approach would be much more appropriate, then of course it will take me extra time to explain a completely different model. And I'm not paid to spend this extra time, and finding extra time when you run a busy clinic is also difficult, and this is another obstacle. The other obstacle is that if we give a patient diet and lifestyle advice, which they want to use, then they are also not supported by our Western lifestyle. For example, one of the main things to do with Ayurvedic diet and lifestyle is to have the main meal for lunch. But in Australia, a lot of people either work through their lunch break or have 10 minutes for lunch. And so they say to me, well, how am I going to achieve my main meal at lunchtime? Another example is there is an emphasis in Ayurveda on a vegetarian diet. But this is not supported in Australia. The quality of vegetarian food in Australia is quite poor and it is difficult to access. Now, the education and training obstacles. To date, there is no recognised postgraduate medical training available to Australian doctors in Ayurvedic medicine. There are diplomas in Ayurveda, but these are not recognised as a medical qualification and they do not count as ongoing medical education. As a vocationally registered doctor, I have to attend a certain number of medical education courses to achieve points every year to maintain my vocational registration. But if I attend a workshop or seminar on Ayurvedic medicine, I do not get any points. Then there are the trade obstacles. In Australia, therapeutic goods are regulated by the Australian Therapeutic Goods Administration. And in Australia, this is widely viewed to be the strictest in the world. In Australia, Ayurvedic medicines are considered to be complementary medicines, and they are required to meet the same standards of quality and safety as other medicines. However, in the US and other Western countries, they are considered to be dietary supplements, and they are not required to meet such standards. In Australia, we cannot import food supplements that claim to have any therapeutic effect. For instance, if we were to import Chyawanprash, we must call it a jam. If we were to claim that Chyawanprash is a great racina and an antioxidant, then it would not be allowed in. So in Australia, it has to be either a food, a cosmetic, or a medicine with nothing in between. However, there are a limited number of Ayurvedic herbs that have been given an Australian L number. This is a listed complementary medicine that the TGA has listed as not fully evaluated but considered safe. So I can use a limited number of Ayurvedic herbs in my practice. However, if I wish to use more of the classical Ayurvedic formulations, which include the Maharishi Ayurveda formulations, I have to ask my patients to order these in for their own personal use from either New Zealand or the United Kingdom. Now, this is also an obstacle because it will cost my patients more money to do this, and it takes longer for them to obtain their products. 5 minutes? Yeah. An individual can import up to 3 months' supply of Ayurvedic herbal products for their own or immediate family's personal use, but it is illegal for them to on-sell these products to any other person in Australia. So after I leave this conference in a few days, I can bring home a suitcase full of beautiful Ayurvedic products, which I can use for my own use or give to my family. But if I were to put these in my clinic and try to sell these to my patients, then I am breaking the law, and there is a fine of imprisonment for that. There is also information obstacles. There is limited information about potential toxins or drug Ayurveda remedy interactions, and this affects my ability to safely incorporate Ayurvedic herbs with Western medications. And there is also limited Western scientific research about traditional Ayurvedic formulations. There is also limited networks available. Diploma level training is offered by government recognised registered training organisations, and just to list a few, there is the Ayurveda College Proprietary Limited in New South Wales, the Ayurvedic Practitioners Association Incorporated in Australia, based in Queensland, which is linked with New Zealand. There is the Australian Institute of Holistic Medicine, Western Australia, and there is the International Vedic Institute, the School of Ayurveda in South Australia. Now, all these organisations tend to offer 2 courses, one being the Certificate 4 in Ayurvedic Lifestyle, which is 1 year, and then the Advanced Diploma of Ayurveda, which is 3 years. However, because this is a diploma and not a medical degree, graduates may practice as a holistic educator in any state in Australia, but as they do not have a medical licence, they must not use the words treat, diagnose or prescribe. They must not call their office a clinic or imply that they are a medical doctor. I will finish with my future vision. In the future, I would like to be able to practice Ayurveda more freely and be joined by many other doctors in Australia who also embrace this model. I would like to see Ayurveda accepted as a valid medical modality and have greater access to Ayurvedic herbal products. Thank you.
Thank you very much, Dr. DE.Cruz, and I think that Dr. DE.Cruz's simple and personal account really gives an insight into exactly the kinds of things we're talking about that need to be addressed. For a well-intentioned young woman who's offering natural health care to her patients, to receive a threatening letter from her National Medical Council is far from a desirable situation. And this is not globalized Ayurveda at all. I think that we need to recognize that this is happening, that well-intentioned physicians, allopathic doctors are in this situation and they need help. And India must step up to the plate and help through consultations with governments and through establishment of international standards, certainly in part through World Health Organization.